Yes, thank you everybody for joining us tonight for this webinar on how ACC helps pet owners in need. I'm glad you're joining us, especially tonight when maybe some of us are pre-gaming before the debate tonight. But this is a wonderful topic and something ACC is doing more and more of, which is resources for pet owners. And as we'll discuss tonight, animal sheltering in general, it's not enough to find new homes for animals, which is of course very important. To find adoptive homes, to find foster homes is super important. But if we really want to end animal homelessness in New York City, which is ACC's mission, we are going to need to also prevent animals from coming to the shelter to begin with, to lower the number who need help and think of innovative ways to help them. So a lot of what we're going to be talking tonight, again, we're focusing really on our admissions department and our community pets program. But a lot of what we do at ACC outside is with this goal in mind of how do we help people keep their pets. So in order to help discuss this very important issue, I have a fantastic panel. Let's see. These are our speakers. And if you guys could turn on your cameras, that would be awesome. I hope they're working. Let's see. Joyce and Manny and Shaniqua, are you guys? Oh, there you are. There's Shaniqua. Hey. And Manny and Joyce, wonderful, thank you. So I'll just give brief introductions of these guys because, like I said, it's a stellar lineup and I'm so glad that they're here to talk with us about their programs. So first off, I'm going to go alphabetical order. Joyce Friedman is our Community Pets Program Manager. Joyce, could you wave for us? I mean, I think it's clear because the picture's there, but that is Joyce. She leads a team which provides free resources to pet owners in need to help prevent pet surrender and provide support for pet owners living in underserved communities. A former clinical social worker, Joyce has extensive experience in the animal protection field, specifically in surrender prevention. She co-developed and was a program manager of the surrender prevention program Pet Help Partners at the Humane Society of the United States, which helped thousands of animals keep thousands of animals in their homes and out of shelters. She's also led workshops to train animal shelters and rescue groups to develop similar pet retention programs and to embrace supporting pet owners in the community as an essential part of animal sheltering. Joyce also has led animal rights legislative campaigns at HSUS and In Defense of Animals and managed volunteer programs at Best Friends Animal Society. She has a master's degree in social work and a bachelor's degree in psychology. So we're very excited, Joyce, to have you here. Thank you so much. We have Manny Huth, has worked in animal welfare for the past 11 years, starting his journey at the ASPCA Animal Hospital as an animal care technician. After working there for a total of 5 years in different positions, he went to Animal Care Centers of NYC to begin with the admissions department as an intake counselor. And we'll talk all about what our counselors do in those, what he would have been doing. He left briefly for a couple of years to work as a coordinator for the internal medicine service at the Animal Medical Center and then returned to us at ACC to supervise the Brooklyn admissions department. Founding member of ACC's Action Grant team. It stands for Accountability, Compassion, and Treatment. And again, we're going to be talking about that in more detail. It's a resource for families that are at risk for surrendering their pet due to not being able to afford the cost of veterinary care. As a surrender prevention coordinator, he worked very closely with his fellow coordinator, Shaniqua, who's here, hey Shaniqua, in structuring the resource. His proudest achievement is the impact the program has had on the local community in Brooklyn and on the surrender preventions to the shelter in general. Manny is passionate about improving access to medicine for all of our animal families in New York City. So thanks, Manny. And Shaniqua, the aforementioned Shaniqua, who has worked on these programs. Shaniqua has been with the admissions department that we're going to talk about since the very beginning, back in 2014. I hope, yes, I got that right, 2014. So she really knows the department inside and out, and it's very exciting that she is here to talk to us about it today. She's been working at ACC for the past 7 years, and her current title is Admissions and Client Care Manager, where she oversees 2 client-facing departments. Throughout her years at ACC, she has worked with pet owners with difficult circumstances and assisting in the best decisions for themselves and their beloved pets. And again, she's been with us since the beginning, so she really has a lot of knowledge and I'm sure hundreds of stories. So it's a really great lineup we have tonight. Thank you guys so much for coming to speak with us. In a moment, I'm going to turn it over to you to tell us more about it. But before I do, I just want to give a brief overview of ACC. I mentioned our mission is to end animal homelessness in New York City. And in order to do that, we also serve many functions. We are an open admissions animal shelter. What that means is we take in any animal, no matter what. And we're unique in New York for that because we're the only organization that must take in any animal that comes to our doors, any homeless animal in need, no matter their medical, no matter their behavioral, no matter their age, doesn't matter the circumstances, it doesn't matter. We will take them in. We are open. And of course, we are also an adoption center. And if you saw our adoption webinar, which I hope you did, you hopefully learned a lot about how you can adopt a pet. Cats, dogs, rabbits, guinea pigs, all pictured here, available for adoption at our 3 full-service care centers in Manhattan, Brooklyn, and Staten Island. As we'll talk about tonight, we also have resource centers in the Bronx and Queens, but if you're coming for adoptions, you want to go to our 3 bigger centers. And the last one is really what we're focusing on tonight, that we are a community resource. We're here to help people keep their pets, to share information that they might need, and just be an asset in the community. And just a quick picture of what open admissions looks like, just for those to give a visual to what it means to be open to all animals. You never know what's going to come through the doors at ACC. And Shaniqua and Manny, Joyce, you guys are usually dealing with companion animals, I would think. I think that's really our focus. We're talking about the pets, but ACC does take in a lot of animals. And again, it might be one more reason why it's so important that we help people with pets, because we're going to get a lot of animals that don't have people and we need to take care of them too. So with that long intro, thank you for bearing with me. I am going to turn it over now to, I believe, Shaniqua is going to kick us off on why we do this, why we do what we do.
Hi, everybody. So looking at this slide, it says supporting pet owners and why is it important? So it is definitely important, to reduce like shelter intakes by having our surrender prevention like programs and our resources. Due to the slide on the left, it stated in 2019, we have taken in 22,410 animals. However, it could have been 25,410 animals that we could have had taken in. But due to the fact that we have like our lovely resources, like low cost medical care, we have like our food pantry, we have tenant advocacies, we have actual physical like supplies we're able to provide to the clients. We were able to like prevent majority of these animals with coming in. And with that being said, if there's less animals coming into the shelter, that means we can focus on the actual animals that are in our care. We can support them, medical wise, and we can support them with like enrichment with our behavior team and with the ACS team that we have there that walks them and deal with them on a daily basis. We can have that capacity in order to like focus on those animals that don't have any place to go when we are helping people that actually want to keep the animals in their forever homes.
Hi, this is Manuel. Thank you all for coming today. So what I'm covering, and I can't really see myself, so forgive me if I'm not holding my camera correctly or you see like half of me and not all of me.
You look great.
Oh, well, thank you. So I also have my daughter here who's turning the water upside down. I'm working on in this presentation is supporting pet owners and why it is important. So I guess the first thing I would note for those people who haven't worked in an open intake shelter is the truth of the matter is most of the people who come to us are not actually, they're there to surrender, but they don't want to surrender. So back when I first started many years ago at ACC, you saw a lot more of people who were just like, I've had enough. And I can't work with my cat or dog anymore. And very rarely, this is extremely rare somebody say, I don't like, Fluffy or Fido, personality wise. It's rarely like a personality conflict where they just don't get along with the animal. It's almost 99% of the time circumstantial by circumstances. And we'll cover this a little bit more in detail later. But things that are happening to people, which can be anything from incarceration to job loss to landlord issues, behavior stuff that they just couldn't get ahead of because maybe they didn't know. And we've actually seen a lot of that change over time. We still have, a high volume of surrenders, but when I first started, the idea that these things were issues that could potentially be addressed didn't really exist in the community anyways. And now you much more frequently see people who are more receptive to solutions, which is really what we're there to offer. So like a behavior is a good one where if you're not aware of that you can address behaviors, let's say with a dog, by the time the person gets to the shelter, those behaviors may have gone so far that even though they don't want to surrender, they're not in a position to really continue to work on those things, because behavior is not a one-stop solution. If you're coming to us and we're giving you behavior suggestions, behavior resources, people who could potentially help with training for that, that's like that's the departure point. So if you've already been on a journey and you're at kind of the end of your journey, we're asking you to come to to reinvest in the beginning. The family may not be there. They may have had an incident. There may have been a bite in the home, or there just may be other unmanageable factors that are there. So we're really trying to invest in an opportunity to assist people who, again, most of the people who come to us do not want to surrender. And the other thing I want to say quickly, I don't want to take up too much time because we do have a lot of information to cover, is it's not, this isn't an animals versus people situation. Like we're here for the animals, but in reality, the animals are not separate from their families. They're generally the most vulnerable member of their family. And next to them would be the children, but animals are by far the ones who will be discharged from the home the quickest. They're obviously susceptible to euthanasia for health or behavior stuff, and they are a part of the family. Whatever the family is going through, the animal will go through. So conversely, when we're helping the animal, we're also assisting the family. They're not separate entities. If a family is going through homelessness and we are stepping in to see what we can do to keep that family together, then that affects the quality of life, not just for the animal, but for the family, because that animal is a functional part of that family. If that animal didn't provide support and love in the family unit, the person wouldn't be trying to keep them. So it's all one thing. It's what the work we do is not both for the people and for the animal. It's all it's a family, and we just work with the animals in the family, but we're here to help the families. So I just wanted to say that in terms of why it's good for both the animals and the people. It's because again they're one family. So that's a very valuable part to me of the work we do with our families in the community.
Thank you all for coming, taking the time this evening. I'll be talking in a few minutes about our Community Pets program, but right now I just wanted to mention the Humane Society of the United States wonderful Pets for Life program created this important chart, which is based on research they've done, which discusses the impact of systemic poverty and institutional discrimination on people and pets. So this is a crowded, very interesting chart. We are going to place the link for this in the chat, so we encourage you to explore it at another time. But I just wanted to mention a couple of things about why supporting pet owners is the right thing to do. So it's very important, I feel, for animal welfare organizations and programs to acknowledge that resource inequity and lack of access to pet services is a social justice issue. And the impacts of institutional racism are severe and enduring for people and pets. We all must realize and keep it top of mind when we're developing programs that help pet owners that systemic poverty definitely eliminates options for pet owners in underserved communities. And the impacts of segregation, education inequity, housing insecurity, implicit bias, healthcare inequities, mass incarceration, and the treatment by law enforcement of people of color all actually impacts the work we do with people and their pets. There's definitely intersections among all of these things. So we feel that people with privilege, including myself, have the responsibility to make ourselves aware and act on these issues. So again, I will put the link in the chat so you can explore further. And Pets for Life at HSUS is a wonderful program that incorporates all of these issues, which we think is really important.
Thank you, Joyce. Yeah, and as we talk about with everything going on with the pandemic, all the problems people are facing, I think it's important to see. I mean, it's always important, but especially now, it's important to see how everything is linked, right, with housing and how that's going to affect animals coming to the shelter, evictions, and everything. So I think this is a really great thing to keep in mind. But with that, let's get into the programs themselves. So Shaniqua, over to you to talk about admissions, surrender prevention. Oh, and I will say, Joyce did put that link. Oh, there's a little feedback, Joyce. I'm sorry. Could you mute? I don't know if it's coming from.
Yes, sorry about
thank
that.
You. No worries. It's only when I talk, I guess. The link is in the chat box, and there was a bit.ly on the slide. So if you're watching this later, we are recording this. You can check it out. We definitely encourage you to check out that graphic. And I will add, because I don't know if I mentioned earlier, at the end, we're going to have a Q&A if you didn't hear that. So please put any questions in the Q&A box. We'll hopefully get to that later. So now, Shaniqua, please tell us all about admissions and surrender prevention.
Hey guys again. So in 2014, we had developed the admissions department, where our main focus was to, isolate, client care, doing everything, and introducing a new department where we could focus on the pet owners, and hearing their true stories as to the reasons why they have to surrender their animals. So before, initially, we was like having conversations in the front lobby in front of everybody, and it was like really crowded. And a lot of people, they wouldn't tell us their true stories due to being embarrassed or feel like they was going to be judged. So they would either like tie the animal up or like gave us false stories due to the fact that they just didn't think that we cared enough, or they felt like, they just didn't want their business out there. But then we came to a point where maybe if we had a separate room, we had a private space for the pet owners to, tell their stories, and that they would be able to be truthful and not to feel like they was being judged in the moment. So when we came to a place for doing that, most of the owners were giving us realistic reasons as to why they had to surrender. And we were able to, go in depth with counseling. So let's just say somebody was like, oh, I'm surrendering because my cat keeps urinating outside the litter box, but they wouldn't explain or elaborate like why they was doing it. So the counselors had to ask questions as to, were you changing the litter box every day? Did you move the litter box like to a certain location in the house? How many cats do you have? And do you have separate litter boxes in the house? And we had to like distinguish between like whether it was environmental or was it medical that the cat was like using the bathroom outside the house. So the more in depth we got in with the owner, the more receptive they were to, take in the information we was provided to them, in order to keep the animals. So sometimes we had to send them to like a vet to get like free vet care, so they can like figure out if it was like a UTI or like a blockage. Maybe we had to supply that owner with like an extra litter box, or like had them talk to like a cat counselor or a consultant that was able to work through any cat behaviors that might have been environmental inside the household. So, and with surrender prevention in 2016, that's where we had came up. Oh, Alex, you go back. In 2016, we came up with the surrender prevention with our action grant that was able to fund clients to go to, the vet. So one of the main reasons why people would surrender their animals to ACC is because they cannot afford vet care. And just because you have an animal doesn't mean that, you're unable to have a pet. Like a lot of people don't know about basic wellness, whether getting vaccines like once a year. And, we hold their hand a little bit just to guide them to like what locations they should go to like once a year, and they are able to do that on their own eventually. Or a lot of people just can't afford when the animal eat a chicken bone during the holidays and they don't have the funding or really don't know what location to go to. That's where they can come to us and we can provide them with that information. Also, we have people that surrender due to moving into a new apartment. And in New York City, everything is like very expensive, and with the economy right now, a lot of people just can't afford. So a lot of people would rather surrender their animals because they feel like it's their last resort of and getting that good housing that they can have at the moment. So we talk to them about like tenant advocacy or making their pet emotional support pet, so they'd be able to like bring it in their new home if that is something they would like to do. So these are just like the many reasons why people will come and surrender their animals to us. Okay, next slide. So there is a difference within the admissions staff. So we have the counselors that's doing that one-on-one interaction with the pet owner to see why they're coming to surrender, what resources we can provide to them, what other options they may have. And even if they have to surrender, doesn't mean that they're doing a bad thing. Like surrendering is a resource as well, because it's helping that pet owner and that animal at the end of the day. And they can ask like profile information to help that animal, pathway throughout the shelter, throughout the duration of their stay at ACC. And then we have the surrender prevention coordinators that deal with complex cases like hoarding cases, medical cases that may be like a social work. So as soon as they start a case, they don't finish it till the very end. And it might be very time consuming. So that's what the surrender prevention coordinators job is consist of, the bigger cases that the admissions counselors don't have time for. Our special intake coordinators are the ones that are going through our surveys each and every day and making appointments for people that have to surrender their animals. We rather clients come in with an appointment due to the fact that if a lot of animals come into the shelter without an appointment, our shelter becomes very packed, and we won't have the time, and we won't have the space to deal with all the animals that we do have here at ACC. So coming in with an appointment, we are referring them to rehoming sites. We are already like pushing appointments like 2 months in advance, or 2 weeks or a month in advance. So like by the time the appointment date comes, they won't show up because they either be home with another family member, or they found out another solution on their own, or with the general counseling they was given upon the initial call with our special intake coordinators. So they coordinate like whether it's animals that need to go diverted or deferred to another shelter, or through our like New Hope partners. We're just making the best plan for like that 13-year-old geriatric, husky, that can't walk any longer, but the end of life is not really there as of yet. So making that suitable decision for that pet owner and pet.
Okay, thank you. And I think you talked about this a little bit already, Shaniqua, when you were talking about, changing the perspective of when people come in and client care and admissions. So this slide is just a little bit about our attitude.
Yeah, so our attitude, like the clients come in of all walks of life, like with all banners and of interest, we just have to, see it for face value, just understand their stories, and knowing, that everybody is coming here because this is what they think is their last resort is, and that they're coming seeking help and not to seek to be judged, and everybody is doing their best. Whether they tied the animal up to the gate, whether they left it in the box, like everybody did what they thought was best for them. Maybe it's something you would not do to your animal, but this is people that don't have the knowledge of like animal welfare, so they're just doing what they feel is best, for them. As long as we come from a non-judgmental place, we're always going to be able to help that person and the pet at the end of the day in the communities that we do service as well.
Love it. Love it.
And
Thank you.
I just want to kind of jump in there quickly.
Yeah, of course.
I just wanted to add to that. Commissioner Shaniqua had talked a little bit about this before. Another thing about the attitude that we foster is it's important for people who are doing the work to, we're not holding the cards, so we need to really partner with the people who are coming to us. And so maintaining a stance of judgment is really not only would I not advise it, there's no efficacy to it. We need to meet people where they're at, and animal welfare, it's a marathon, it's not a sprint, and it's something that if you're going to be effective, you're going to be doing it for a long time. And coming at clients or people who we're working with in community with an idea of what we think is right for them, or right for their animal, is just it's not basically it's going to be very detrimental to actually getting something done that's worthwhile for that animal that you're advocating for, and for that family that is looking for your assistance.
Sure.
And
No,
for us doing the work, it's like we need to step back. It's easy to become judgmental, but it has some serious mental health side effects. So it's very important to kind of like adhere to the stuff that Shaniqua is articulating. So, okay.
Yeah, no, great points. Thank you. I think the next slide, again, we've talked a bit about it. Shaniqua, you were mentioning all the different ways that we've helped people. So I think this is just a rundown. I don't know if you want to add anything. But yeah, and I don't know, Manny or Shaniqua, if you were planning on chatting about this slide, but you guys, we did put our resource flyer here. This is a flyer we have available on our website. And right now, I don't know if we'd want to use it so much because our Queens Resource Center is closed. It's not up to date for COVID information, but we do have a flyer that we bring to outreach events where we tell people we have all these resources available. And as you can see, there's quite a lot there.
So yeah, one of the first things you see up there is the kind of connection to vet services. Now that can happen via surrender, but that is mainly going to have a placement trajectory. But people can and will surrender, so that we can maybe get a better medical outcome for their beloved animal. But the main thing that we utilize in the shelters in Manhattan and Brooklyn and Staten Island and the resource centers is the action program, which Shaniqua and I worked on with our blood, sweat, and tears to get that up and running. And the main couple of important things about that is one, the program is not there's no means testing, so we take the family's word that they're coming, they're asking for help, and that's enough. The primary evaluation is obviously medical. We want to get a sense of what's happening, but one of the big practices that we use in that program is to make sure we are developing a point of departure that is based on partnership. And the reason for that is, if we just send the family to our vet partner, to the animal hospital, and say, don't worry about it, we're going to cover everything, just go over there. When you're dealing with medicine for animals, one of the big barriers you're going to run into is non-compliance. They can go to the vet, but the cat or the dog or the rabbit or the hamster does not give itself medication, does not cage rest itself, does not bring itself back for a recheck, does not sit still for its x-ray. So, you can, if you want to indulge your critical mind and look past the family and only focus on the animal, you can do that, but I guarantee you that's not going to work for the medical care, because it is the guardian of that animal that is responsible for applying the care that they're given, for being able to communicate to the doctor, for the doctor to be able to make sure that they're being understood. And if they're not understood, we need to be there to make sure that we are facilitating that conversation or liaison, or going in between. So really, once we get the medical story, we also want to have a long conversation about what we're expecting, what some of their expectations might be in terms of recovery, or again, application of medicines, in accordance with what we may be seeing, what some of the outcomes that we're not seeing that could be possible. We always have to let people know there could be other underlying medical conditions, which happens frequently. So you go there for a broken leg, but the dog or the cat has a grade 4 heart murmur, or may have some other abnormalities on blood work. So those conversations are very important. If the family can make a financial contribution, that's great, but not required. And really, the most important thing is that if they come to us without any experience with medical stuff with animals, that we get them engaged and give them a sense of agency about what's happening and what's going to happen, because they wouldn't be there coming to us if they didn't have some sense of wanting to participate, and they have to. So that's a big part, and our coordinators do a great job with that. that is like 95% of their job. And then,
And I'm sorry, just to interrupt for a moment, to
Yeah.
clarify, what you're speaking about right now is specifically the action program?
Yes,
Or
correct.
okay.
That
Yeah.
is, which is like that's our it plays a very big part in our surrender prevention. The
Yeah.
access to medical care in New York City is, so a friend of mine told me, this is not a verified stat, but that animals in New York City have some of the best qualities of life in the country. Having said that, whatever medical care that they're getting now, I can guarantee you it's just the tip of the iceberg in terms of the animals that are in need. Access to medical care is a huge issue. We see it every day in the shelter. People come to the shelter. For that, we're not a hospital. And sometimes when they're having an emergency, we're their first stop, which can be, a critical problem if the animal just got hit by a car or really needs life-saving treatment right away. So yeah, I mean, the access to medical care plays such a huge part in our surrender prevention. So I just wanted to share about that.
And I think the next slide is two animals who benefited from it. So maybe we'll move to that.
Yeah.
Unless you want to quickly touch on these other ones, just for time reasons. I mean, because we have like so much great stuff on this
Yeah,
program.
sorry.
No, don't apologize. It's all great. I'm just looking. I think these are pretty self-explanatory. The other ones.
Yeah.
Maybe just if you want to mention Europals and Paws New York, or
Yeah, I mean, we use all that stuff. I've actually worked with Paws not just at ACC, but at Animal Medical Center as well. They work with like elderly populations who are really financially at risk, and they mostly do stuff where they send volunteers to help walk. Or I've seen cases when I was at AMC where they would help administer medications. They would bring animals to vet visits, and our like animals are at risk, but our seniors in the city who are financially vulnerable are extremely at risk. A lot of them don't have anybody to help them, so that's an extremely valuable resource.
that's Paws New York that they help seniors, right? Just for people who don't. Yeah.
Correct.
All right.
Yeah.
So let me show these pictures because they're super cute.
So Tiny was our, I think, FHO.
Yeah.
So that's interesting because it's kind of hard to get help with orthopedic stuff. And we really try to do the best we can. In a lot of animal welfares, there are things that are kind of outside the guidelines. You'll see that with like tumors and growths and stuff. It's not that those things aren't treatable, but it's just they kind of have a really high rate of return. Orthopedic stuff tends to be chronic, but it's a real quality of life issue. Like, a dog or a cat can live with like a limp or can live in pain, but it's really not okay for them to have to exist like that. So when we can, we do try to cover these types of surgeries. So Tiny came to us. The family had a very big surgery that they cannot afford. It was an FHO, which is a femoral head hysterectomy, where they kind of shave down one of the bones to make it fit better. This family was on a fixed income. And I think they were able to raise through GoFundMe like $100. But really, it's like the whole family pitched in to make sure that Tiny got the care that he needed, that this is a large dog. So, when you have orthopedic stuff for a dog that size, like they can't go downstairs. I had to do that with my dog. I had to carry him down 3 flights of stairs. He's 70 pounds. It is backbreaking. So really, and that's the type of stuff we're talking about where it's like, you'd be surprised. I know it can be very discouraging to see people with their hand out and just see it every day, but you'd be surprised how often people rise to the occasion. And again, they put a little something towards the care with $100, and that's great. But really, what the substance of his case is the way the family pulled together to make sure that Tiny recovered well, because you can ruin an orthopedic surgery if the animal is not recovered properly. So it's a great success story. And, as you can see, Tiny's a big boy, but he got the care he needed. And it's because the family took the time and effort to come seek help. And also, I don't want to underestimate the value of that as well, because it's not easy. It's to go somewhere and, just be honest and say, look, we're having this situation and we're trying to do what's right for our beloved family member, but we can't get it done on their own. That's a good first step. That's something we can work with. And Tiny was a great success story for that. So yeah, that's Tiny.
Thank you. No, that's great. Thank you. And I mean, I don't know if we don't really have time, I think, to get into all the detail about Kratos, but I know that this was another animal, correct me if I'm wrong, who I think ate something that he wasn't supposed to eat. Had to go to an emergency.
We see a lot of that too, yeah.
Had an emergency apart, and what we did was, again, we don't do the medical care, but we have partners that we work with, and we were able to make an emergency appointment with a partner vest, and Action was able to cover how much it cost. And he did, I think, I'm looking here, yes, he had foreign objects in his stomach when he went to the hospital. And I believe this was an ESA animal, so he's her emotional support animal. And I hope I got that story. I just summarized it really quickly for time, but again, they didn't have to surrender because of medical care. So that's, again, these are two big dogs too, and gosh knows we have a lot of big dogs already at the shelter. So if they already have loving families, best to keep them. And now, just really quickly, I know we included this just to give people an idea of what's on our website, that we have a lot of resources available, but also if you do need to surrender your pet, you can go here. And Shaniqua and Manny, please let me know if I'm wrong, but I think it's just as simple as emailing us, filling out a questionnaire.
Yeah, so when I go on the ACC website, it says like services, and then you'll go down to surrender a pet, and then there's a link that goes to a questionnaire, and they'll fill that out. And then our special intake coordinator will reach back within 24 to 48 hours tops to reach out to make an appointment.
Awesome, thank you. And again, I guess they should people use this form even if they don't think they need to surrender, they just need help right, in general?
Yes.
Sorry, my brain just, okay. And then also on our website, this is on the same page, right? I think it's on the same page.
Correct.
We have rehoming options. So a lot of what we try to do, and again, please correct me if I'm wrong, but if we can redirect people before they even come to us, that's great. I mean, ideally they can keep their pet, and we have behavior flyers, which is on a separate separate page you can see there. So if anyone's having behavior issues, which is a real big reason, right, behavior, that people surrender, they can check out our flyers. And then if they do have to surrender, though, again, even before they come to us, if they know they have to surrender, we encourage them to use these other resources, Get Your Pet and Find Your Pet a New Home. And again, that is on that surrender page that's available there. All right. And if people can't go online, Shaniqua and Manny, they can call us. Is that the best thing to do if people need to reach us?
If they call us, they might not be able to get to us because our phone lines ring off the hook. So if they email our information account, information at NYCACC, we'll always get those emails as well. Or they can, email our missions at nycacc.org.
Great, I'll put those in the chat. Thank you. All right, and I think now we're going to move over to just reunifications. And again, just for time, I think we have to be pretty quick. But Shaniqua, could you tell us a little bit about what we do on this end?
Yeah, so last year, we reunited 1,690 animals, back to their owners. So a lot of people, reunifications happen while, their animals must have ran away. They must have got lost during moving, or, owners, they surrender, but then they have a change of heart once they go back home and they realize like, oh my gosh, I really miss my animal. Or maybe the counseling we gave them, they started to set in like once they got home, because it was like a lot going on. And then once they got home, they was like, oh, maybe I could have, did exactly what that counselor told me to do, in order to keep my pet. So we have reunifications that way as well. So with reunifications, every animal has to leave going back home spayed and neutered. They leave with a microchip. The microchip is just in case they get lost or stolen, and they end up at like an animal shelter or a vet. We're able to like locate the owner. ID tags like with the pet name, so if the animal does go missing, at least like the finder will know the animal's name. And for dogs, they'll leave with a New York City dog license. And with like getting the animal back home, we offer supplies. So just in case like there was a dog that was left in the yard and then it broke out of the yard, there's been plenty of cases where ACC like helped the owners like build back their fence, for the animal won't run away again. There was a lot of times where we provide like food because the person had to surrender because they couldn't afford like food for their animals. So when they claimed, we was able to provide that. Any litter or any like carriers they may need to take the animals back and forth to the vet, or even when dogs or cats might run out and then they get attacked by another animal. And then the owners find out there was like, oh, you know, your animal was attacked, and they're like, oh my gosh, I don't know what to do. I just thought I was coming here to pick up my animal. So, you know, we will locate them with low cost vet care and to provide to them, so they will just won't go back home with that open wound they came into ACC with. So
okay, that's great. Yeah, thank you so much. I'm going to take this occasion just to remind everybody really quickly, because this is so important to get out there, that if you ever lose or find an animal, a stray cat or dog, mostly, well, dog, we had a whole thing on community cats in our last webinar on how to be a good neighbor. But if you find a lost animal, please file a found report. If you lose an animal, file a lost pet report. You can also text Lost Pet NYC to 56525. This is a screenshot of our website, and you can go to our website. And again, this is where you file a report, and you also have a lot of resources. So hopefully you can find your animal as soon as possible. So that was just a little PSA to get in that public service announcement. It's so important. And now we're ready for Community Pets, which is a whole other program that builds off in the surrender prevention. So over to you, Joyce.
So our Community Pets program is a very innovative and progressive program, which runs on the same mission and assumptions as admissions does, as surrender prevention program that Manny and Shaniqua talked about, which is a non-judgmental attitude and understanding of people who might be living in poverty or living in underserved communities where there are very few pet-related resources, and acknowledging that they too love animals and have the right to rescue or adopt and take in pets into their home. So what we do to help keep animals in the homes they already have, which has been mentioned before, which is a much better solution than taking in every animal someone might think they need to give up into an overcrowded shelter, which would become, rather than, well, these animals already have a home, let's provide free resources. We're not means-based. We provide everything for free. And basically, we provide, we do free vaccine clinics. We do free vaccine and microchip clinics. We provide free dog training. We provide free cat behavior assistance. And we also provide free spay-neuter referrals and coordination of free spay-neuter. Alex, if you could just go back to the first slide of my grouping. I just wanted to say a couple of things about the next one. Yeah, sorry about that. Okay, so we vaccinated and microchipped 2,886 pets. This is dogs and cats in 2019. And what we do is we canvass on the ground, good old-fashioned boots on the ground canvassing, to advertise these vaccine and microchip clinics. And you see an example of a flyer there, and we have a great team who literally goes around the community a few days before the clinics and passes out, puts up, hangs up these flyers. And the reason for that is so that the resources are reserved for people who really need it in the communities that we have researched are most in need. We obviously can't help every community, but what our funding currently is for the most underserved communities in the Bronx and in Queens. So if you can go to the next slide. And here we talk a little bit about our partnership with the Toby Project, which is a fantastic partnership. And what we do is after every vaccine clinic, the very next day usually, or a couple of days after in the same location, to make it easiest for folks who can travel with their pets, we sign people up who need spay-neuter. And it is funded by us through the Toby Project, completely free for the clients. For the additional folks who need free spay-neuter, who cannot get appointments on the Toby Project because each clinic is limited, we assist, coordinate, and do some hand-holding with folks to either get them appointments at or give them the information and follow up with them for the ASPCA mobile spay-neuter as well. And for the folks whom we assisted either through the Toby Project or through coordination and referral to the ASPCA, we enabled 437 pets to be spay-neutered in 2019, and actually over 1,000 more we gave information to. We just weren't able to follow up if they actually, we weren't able to get feedback from them if they actually got the spay-neuter on their own or through these resources. And then if we can look at the behavior training slide for a second, this is one of my favorite parts of the program. So we partner with fantastic local dog trainers who are all positive reinforcement trainers. That's the kind of training we use. And they provide free dog training classes in the same neighborhoods throughout the fall, spring, and summer months in parks. And we do the same kind of canvassing. That's an example of our free dog training flyer, so that people in the local community could become aware of it. And we have a certificate that dogs will get if they attend any 4 classes. And we have like a dozen more of these adorable photos with animals getting these certificates. People are not forced to attend all 4, but if they do any 4, they do get that certificate. So we also have a food pantry. Some of you are familiar with it. So our pet food pantry is located in our Bronx center. It is for Bronx residents in need. That is what our funding is able to do at this point. And in 2019, we distributed over 30,000 pounds of dog and cat food. That's a clip of a New York Times article from a while back, which was a great highlighting of the program. And in a few minutes, when we go to our COVID, our reaction and response to COVID, I'll talk a little bit more about how we've expanded that during COVID.
And before I go over to the COVID section, I just want to have a page about the field services department at ACC, because they're not on the call tonight. We don't have a field representative here, but field does a lot of work helping people keep pets. Joyce, I'm sorry, can I ask you to mute again? I don't know if it's just me getting the feedback. Perfect. Thank you so much. So our field department does so much great work. They're often reuniting animals in the field. So, Shanique was talking about how we are reuniting animals at the shelter. You see some pictures here of dogs that didn't even have to come to ACC, because our field team will respond, and they have scanners for microchips. And if they can reunite animals without coming to ACC, all the better. So those are some pictures of when our field officers, our animal rescue specialists, have been able to help. Our animal rescue team also responds to disasters. ACC is part of New York City's Animal Planning Task Force, which again will come into play when we talk about COVID. But what that means is we respond to disasters like fires, and there's some pictures here. So whenever we can go and respond where pet owners may be impacted, we are going to play a role. The last bit I just want to mention here, or second to last, is this picture of Lucy, or these pictures of Lucy the dog. And our field team was able to work in coordination with the rest of our staff on getting food to Lucy's owner. And Joyce, correct me if I'm wrong, but I believe this was last year, and the owner had previously lost his job just a couple months earlier and was really down to like no food, and was even giving Lucy his own food, and reached out to us, and we were able to drop off food so he could keep his pet, who he loved dearly. And I think we followed up with him a little while later, and he said, at that point, I think he was able to get a job. So this is just one dog who was impacted. And again, I just wanted to point out that our field team does a lot. Right now, one of our animal rescue specialists, Caddy, is going to someone's apartment and 2 to 3 times a week caring for a cat there that this person has had, I think, for more than 15 years. And the man had a stroke and had to go to the hospital and is going to physical therapy. So she's helping care for the cat. And again, much better than bringing the cat to the shelter. So again, I just wanted to highlight field, and they'll come up again. But now over to all the support we've been doing during COVID. So how have these programs been playing a role in this unprecedented time?
We were all here for the pandemic, and we know how devastating that was. ACC as a whole, ACC as a whole, and admissions in particular, but really, pandemic was one of those things where all departments were involved in coming together. So I think everyone had a high exposure. We really had a front row seat to the suffering that was bared upon the entire city, myself included. I was hospitalized for COVID myself, very scary. But the animals were just, people were being hospitalized or passing away, and many animals were being left alone. And it really took a kind of citywide effort between all the players in animal welfare to kind of coordinate all types of things. We really focused hard on trying to get boarding options, primarily. A lot of those, sometimes we were able to do that, sometimes not. There was kind of shelter in place which we worked very hard on as well to see if we couldn't get these animals into some type of boarding situation through some of our partnerships, with ASPCA or Animal Haven and stuff like that. Then, if we could get other partners to kind of help with shelter in place where people would come and visit the animal and drop food and water and make sure they were okay. A lot of it, honestly, also came down to making sure that these animals were retrieved from homes where, they weren't abandoned in the typical way that we understand abandonment, but when a person is being rushed off to the hospital, doesn't know when they're coming home, and doesn't have anybody either to come in and pick up their animal, or nobody knew that they were even not there, we need to make sure that we are able to get those animals and bring them in and to make sure they have food, shelter, and water, and then go about trying to locate the either guardian of this animal or their family, and see if we can't reunite them with the family. Obviously, if we can't do that, we're seeking placement. But it was just it was intense, and it took a lot of.
And here you can see some of the stories that you're talking about, the pet retrievals, right? I think this is Abe and Faraz.
Yeah. And to talk about field, I mean, they were, really deeply involved in entering those homes. We've even had to contact the sheriffs to gain us access to places that nobody had a key to and the landlord could not assist with. But really, it was an all hands on deck type of thing. And every department in ACC and every, animal welfare outfit in New York was up front and center, doing what we all had to do. In some instances, there were so many players involved, some of the cases got a little confused because there's just so many people like rushing to the aid of an animal in need. But,
well, it's good to hear. I'm glad there was so much. I mean, and you have the chart here. I don't know if it'll make sense to everybody. I mean, I have to look at it for a while to figure it out, but it was really, there was a whole plan on what goes where and who, how we channeled calls. And you can see the field team played a big role in a lot of what we did, whether the animal ended up at ACC or not, the field team was often playing a big role. And like you said, I'm sorry, yeah.
I know. I realized I failed to articulate. So there was an actual format that was being used where people we get requests coming in through the APTF hotline, that's Animal Planning Task Force, and whoever was operating on that call would give a rundown of why we were being contacted, as much information as could be gathered, where the person was located, their phone number, their address, and from there. That's where the kind of distribution point was to see who was picking up the case. Sometimes these cases we'd get a request, but the ASPCA was already on it, or it was being referred directly to us for surrender, but we'd still do some prevention, or we'd start working on boarding options or contact Jenny Coffey to see if she could assist with some of her resources. So yeah, that hotline was the citywide open channel for people to contact us, and that's where all our cases funneled through. So I should mention that.
Oh, thank you. And just to clarify, I think we had one question about this. It is ending, I believe, tomorrow, the hotline. Obviously, ACC is still here, as we always are, crisis or not. So if anyone needs help, they can still contact our admissions and surrender prevention team. But I believe the hotline is going to not function this way after tomorrow. And like you said, teamwork, it's all about teamwork. And within ACC, there were a lot of people working. So Joyce, if you could just talk a little bit about what Community Pets did during COVID, or is doing still.
Absolutely. So naturally, we had to suspend our large outdoor events, vaccine clinics and free dog training classes. However, our dog trainers have been amazing, and we have been referring to them cases where our trainers are helping people with their dogs on Zoom. So they've done a lot of surrender prevention through Zoom dog training sessions. And right now, our dog trainers are slowly starting to do in person. But so what happened during COVID since mid-March, still happening now, our program transitioned over to food. So basically, we expanded from helping Bronx residents with pet food to the 5 boroughs. And we work very closely with admissions. Shaniqua and Manny know we're very often, almost daily, emailing them and their staff and saying, oh, we have a client who needs to pick up pet food at your center. Can we do that? And the answer, of course, is always yes, and we coordinate. But what our team is doing, our amazing team, is supplying human food pantries with pet food. I saw someone in the question and answer box had a question about this, so here's your answer. Yes, we are supplying, obviously we cannot supply every human food pantry around the city with food. We wish we could, but we actually started partnering with 4 amazing Queens-based community COVID response groups in the epicenter of where COVID hit, and that was in East Elmhurst and Corona and Elmhurst and Jackson Heights, Queens. So we still are supplying pet food. You'll see a couple of pictures there with the large amounts of food with our van to human food pantries so that when people come for their food, they can also get pet food. We also are doing hundreds of curbside deliveries for people who have to be homebound, immune compromised clients who cannot leave or they would be risking their health during COVID. And then as things started opening up, we have now done 7 pop-up food pantries in the Bronx, a few blocks from our Bronx center, which hadn't opened at the time, and we've served 371 clients. So we've delivered over 40,000 pounds of food since COVID hit, and if you notice, that's more than we delivered the entire year, distributed, I should say, the entire year last. And if you go to the next slide, real quick, I can just tell you about, you can just see for yourself. So these are happy clients, 2-legged and 4-legged. And in the bottom right corner is one of the amazing groups in Queens called NICE. And they set up, as you see, pet food distribution. They're going through very quickly as they also give out human food. And that's our amazing coordinator, Chris, who's pretty much our only driver. In addition, I just want to give a shout out. We have a fantastic transport volunteer team that came together just from COVID. These are dog walkers who couldn't walk dogs when we had to stop our volunteering, and they are going around the city on their own time as volunteers, helping deliver food to clients. So I'm really grateful for them, and I also want to give a shout out to the ASPCA for donating so much of this food during COVID to us to then give out, as well as a Petco in the Bronx who donates to us almost every week with food as well. And of course, individual donors like yourselves who have donated so much funds and money and pet food to us.
Yeah.
I can be real quick with this. Alfred and Dexter. So Alfred is the human, Dexter is the dog. He also actually has 2 dogs. They're both almost 100 pounds. He lost his job due to COVID. We have now delivered food to him twice. And the story about Alfred, Dexter, who you see here, is, as a lot of pit bull type dogs do, he had a bad skin condition and he can't eat chicken. And we actually just happened to get donations twice of chicken-free, grain-free food. The food we purchased for our pantry is your standard food. So he was really, really grateful. And our volunteers actually delivered to Alfred and Dexter and his other dog twice. And they reported back on the second visit, his skin looked so much better. And real quick, Brandon is an owner of Roman and Zoe. That's Roman right there. And Brandon lost his job due to COVID. He also suffers from asthma. So he's homebound and he really literally could not afford or even leave his house to get food. But he has family members named Roman and Zoe. So we have delivered food several times to him to enable his safety and to keep Roman and Zoe well.
Fantastic. Thank you. And yeah, as Joyce mentioned, we do have wonderful donors and partners, and we're so grateful for that. But we also need individual support. And so if you're so moved from all these stories and everything, I hope you'll consider supporting the Community Pets program and also just our general efforts. Surrender prevention is a big part, as we discussed, at what we do at ACC. You can donate online at nycacc.org/donate. And you'll see at the top of that, there's a Community Pets Fund. So if you want your donation to go directly to the Community Pets program, you can direct it that way. You also support ACC and to make a general donation every time you shop on Amazon. Smile if you select us as your charity. So that's another way to just add and help. And then of course we do accept unopened food for cats and dogs. And Joyce has informed me that canned food especially is needed. I believe we tend to get more dry, or we purchase more dry, but we can always use canned. And if you're interested in donating, please bring that by. Shaniqua or Manny, correct me though, if I don't know if we prefer people call ahead now, given we're on an appointment basis at COVID. If not, I think you can leave it outside of our care centers, but we do we do accept and are very grateful for any kind of pet food. So I know it is after 7. I'm so grateful to everybody who is still with us and stayed so patient. So thank you so much. I do want to have a little time for Q&A. If our panelists could stay just a few more minutes, I don't know if it works for you guys. If you have to go, I understand. I will go through because we've been getting some Q&As. I think we've been answering some of them, but let me just go. Joyce, I'm so sorry. I'm going to ask you to mute again. Sorry. I don't know why that happens. It's very weird. Let's see. Well, somebody asked who gave ACC. Let's see. We have who gave ACC the action grant. So that grant that helps us get all that medical care. My understanding is it was the ASPCA in the beginning. Is that correct? The grant itself. And now, of course, we have funding from a variety of sources. Correct me if I'm wrong, though. Shaniqua or Manny, please.
Yeah, Shaniqua, you want to jump in on that and talk about the beginning?
Yeah, so the ASPCA initially gave us our grant in 2016. We went out to California and did a shadowing with the shelter over there. However, throughout the years, we have gotten donations and other grants to other organizations. But the ASPCA initially gave us the grant. Yes.
Okay. And Joyce, I think you answered this, but as you mentioned, someone asked, is there partnership or information sharing with other social service providers, such as food pantries? This person writes, it seems to me that some people using those services may also need assistance with pet support to prevent surrender. And I think that's totally right. I think, again, the intersection with other issues with other organizations is something that we can build on and that you already do some work with. I don't know if you want to add anything, but...
Sure, I can add real quick. So we're always learning ourselves. So we learned that that's so important during COVID, but that is always important, right? Any human food pantry, even before COVID, there are folks who rely on them. They should all carry pet food. And I know the ASPCA has played a large role in helping human food pantries to request from the big New York Food Bank, and I might be using the terminology a little incorrectly, but they don't all request it, or they may not know there's a need. So getting back to us, yes, we've learned that, and the more funding we receive to purchase more food, and the more large donations we get, we can supply more human food pantries. It takes a lot of coordination, so that's why it's limited. But again, the more funding we get to purchase food, then the more food we can supply and partner with human food pantries. And I think, Jocelyn, you wrote a question about organizing a pet food drive in Rockaway. I answered, actually, you can email us and we can talk more about that. communitypets@nycacc.org.
Awesome. Thank you. Yeah, no, we appreciate that. I'm so glad you're thinking that. That's a great idea.
I think Lindsay is asking, is there anywhere to see where pet food is currently available? Oh. So Lindsay, I think you might be saying, okay, so the ASPCA will be stopping their food distribution, their COVID food distribution in about the end of the week. So we are continuing, and I'm not sure, I guess, what you're referring to. I guess you mean other than ACC. I'm not aware of anywhere else that is giving away free pet food except some human food pantries, but you could email us if you have further questions about that.
Thank you so much. Right. And someone is saying, my local vet posted on their Facebook page that they had the third animal in a few weeks left at their door. And a lot of dogs and friendly cats have been reported found, I guess, recently. So yeah, she was asking about resources for financially distressed people. What exists in the communities. Hers is the Rockaways for financially distressed pet parents. I don't know if I got the whole question there, but I think we cover a lot of what the resources are. But in general, yeah, if you ever want to give out, since this is in Queens, which Community Pets does address, right? They can email communitypets@nycacc.org. And if you're in another borough and you know people who need, they can email admissions@nycacc.org or info@, which Shaniqua mentioned earlier. All of the contact information is on our site. So please do go to our website for information, nycacc.org. If that isn't enough for you, or you need more, you see the email here, communityoutreach@nycacc.org. Please, I will check that, follow up. If there's any questions that you think of later, we will definitely get back to you if we didn't get to it tonight. Let's see. But definitely, we don't want people just, abandoning animals. We want to help them if we can.
Can I just jump in quickly
please.
on that?
Yeah.
If one of the interesting things about one of the slides you presented, which Shaniqua spoke on, is if you look at the stats for our surrenders, you'd be surprised. Our stray surrenders, both for dogs and cats, actually outnumber our owner surrenders, which means that, especially for dogs in New York City, it's very surprising. But what that means is that people either don't know or don't think that they should come to the shelter when they're in that time of need. So obviously it's better that they leave an animal near a vet clinic or hospital who will know to contact us. But really just getting the information out there that, the animal shelter is a place of support. And, if you're thinking that you can't handle what's going on with your cat or dog, to please contact us, because as we are very high volume, we do a lot of intakes. But if so many of those intakes are strays, that means that there's a lot of people who don't know that they can come to us. And we want to prevent surrenders when we can, but we definitely don't want to discourage people from doing what has to be done. So the stray intake volume is extremely high. So that phenomenon where this person is saying the vet that they go to is having animals left at them, that's a big phenomenon. And just dogs wandering the street, like, you'd be surprised at how many of those come in either with the police or a Good Samaritan from the public, both large and small. So if anyone knows somebody who's going through that, again, instead of judging or being critical, just open your ear and pass along the information. We all need to be working together to help animal homelessness in New York City.
Yeah, I'm so glad we did this tonight, because I think a lot of people don't know that this is such a big part of what ACC does, is to try to help people keep their pets, right? It's not just, it's somewhere to bring an animal when they have no other place to go. It's really, what can we do to get animals who have loving families back in the community? So I'm glad we got to talk about that. That being said, we do have limited resources, right? Oh, yeah, sorry, Joyce. What was that?
Sorry, yeah, I was just going to add to what Manny said, which is great, that the person who wrote about their vet seeing a lot of animals left there. I mean, one thing the vet could be advised to do if they want is they could put a notice or a flyer there saying, do you need help keeping your pet? Because to try to address people who have issues, which then would maybe lead them eventually to abandon the dog there. And then if you have trouble keeping your pet, contact admissions at nycacc.org. And again, that's how they can get some of our resources if applicable.
Yeah. And again, we may not, and again, three of you, please correct me if I'm wrong, we're not always necessarily able to help. We don't have all the answers. We can't provide all the solutions, but many times we are able to help. And sometimes it's a very simple thing, like a harness for somebody whose dog is pulling. So it's always worth reaching out and having that discussion. And, if we can't help, hopefully we can refer you somewhere else or do something, but it's definitely worth reaching out. Now, someone did ask and we'll just take, I think, a couple more minutes because it's already 7:15. So I apologize for going over, but I did want to bring this up. Someone said, what do you see as the number one cause for animal surrenders? And I don't know if we've run the report most recently for 2019, but my understanding is housing related issues tend to be up there, along with, I don't know if it's more than or equal to behavior issues.
Yeah, housing and behavior issues is like the number one thing.
Yeah. And whether that's landlords or, so many buildings in New York City don't allow pets, or they have a weight restriction. And yeah, we're all, I think, a little nervous about what the coming expected eviction crisis is gonna bring. So any support we can provide people who are struggling with those issues. Yes, Joyce, please.
I'll just jump in on that real quickly. So we work with a tenant advocate who provides free services to help people not only register their own animal who might be an emotional support animal and negotiate with their landlord if their landlord is threatening to evict them, but also to help bring their emotional support animal into Department of Homeless Services shelters. So that's a whole other topic, but our shelters currently don't allow people with pets in them, and so many people are entering homeless shelters, obviously. But if they do have an emotional support animal, we have a tenant advocate who works closely with our admissions department and sometimes with our program as you guys know, to help so those people and pets don't have to separate. If you know of anyone like that, you should refer them to us.
Yes, thank you so much. Thanks for that. Someone asked, you have a Seniors for Seniors program, and I think they're referring to our wonderful adoption program, where if anyone is over 60 and they're interested in adopting an animal who's at least 6 years old, the adoption fee is completely waived, which is awesome. So that's our Seniors for Seniors program. This person is asking if we have anything set up to provide support for seniors who would love to adopt but can't afford the care, not just the adoption fee. And again, please correct me if I'm wrong, but my understanding is, again, we don't have a specific senior program, but we have all of these resources that can help people keep their pets. But I don't think we have a specific seniors. That New York Paws, Manny, you mentioned that they provide specifically to seniors, right? Help.
Assistance is more along the line of kind of supportive stuff.
Yeah.
I have seen them fund some care, but you know, AMC, who is not like driven towards some of the goals, they more operate with sophisticated medicine. They actually work a lot with seniors for who are at risk. So that's one possible option. The other thing is straight out the gate for adoptions. Obviously, like adoptions is making their own plan with each client about like guiding them towards what they should be expecting for vet care. But once a person is been with the animal after a certain amount of time and is settled into the home, if they're having trouble meeting the needs of something like veterinary care or other things, admissions is definitely there to work on them with the plan and get some type of get them the support they need. And so much of it a lot of times is just planning. You know, it's just trying to figure out you know, what are the needs, where are they at in terms of what their needs as a human are, and what are their capabilities in terms of movement. Do they have help? Do they need help? And just working with the individual on what works for them. So though there's not a specific program, admissions is designed to be like a problem-solving unit, and we'd certainly encourage our elderly community to seek assistance when they need it, or especially if they have social workers or home health aides. Those people can be really helpful primaries for people who need to contact us. But you know, our elderly community is definitely needs a lot of support in this city, you know, and they're really great families for our animals who need adoptions. So we definitely want to support them. And if they come to us, we will work with them.
All right. Well, thank you so much. I think because for time, yeah, we're going to stop. But again, I really appreciate, first of all, the panelists for all you've done tonight, including staying late. Thank you for that. Thank you to all of our amazing attendees who have also stayed, and just for coming and being interested in this, and yeah, taking an interest and hopefully spreading the word to people, hopefully supporting the programs that we've discussed so we can do even more. With more resources, we can, of course, do more. And again, yeah, just sharing your Tuesday evening with us. And again, this is recorded, so if you want to check back later, if you've missed any of it, you can see it. Our email is communityoutreach@nycacc.org. Joy, Shaniqua, Manny, thank you so much. I mean, we've already talked a lot, but I don't know if you guys have any final words. But thank you so much for sharing all of your knowledge.
I just want to shout out to Field.
Yeah,
you mentioned the elderly stuff. They're actually, like you mentioned that story with Caddy, admissions is directly involved in that. And our field team really goes above and beyond. We had a case today, which I'm not going to go into detail because we're wrapping up, who they had to bring an animal in that has now been returned to the owner who has mobility issues and other stuff going on. So just shout out to Field, because when it comes to our elderly communities, they're right up in there, because they're the ones who may have to facilitate transportation in cases like that. So, you know, just shout out to y'all.
Thank you to all the guests too.
Shout out to ACC as well, allowing us to have this time, you know, to share, you know, what our departments do as a whole to keep pet owners, you know, and their pets at home.
And I'd like to thank Alex. Alex, you've done an amazing job in coordinating this. We couldn't have done this without you, and I'm so glad the community has an opportunity to learn about our program. So thanks, Alex.
Thank you. Well, again, it's an ongoing conversation, so I hope if people want to learn more or have more, they can always email us and check out our website and our social media links, which are also on this page. So thank you, everybody. Have a wonderful, wonderful night and stay safe. Be well. Good night.
Right.